Here you can see the learning objectives that you should be able to achieve by the end of this training. To increase your knowledge, you can also refer to the PDF supplied for more details on the topics covered here. Syphilis is a multi-stage disease with diverse and wide-ranging manifestations. The infection can be split into primary, secondary, latent, and tertiary phases. Move the slider to see how the infection develops. T. pallidum can be transmitted from the bloodstream of the infected woman to her developing fetus at any time during pregnancy. However, risk of fetal infection is much higher during early maternal syphilis, the first year of infection, than during later stages. Congenital syphilis is divided into early congenital syphilis and late congenital syphilis. Syphilis testing should be performed on all patients with typical signs or symptoms of the infection, as well as high-risk patients who are asymptomatic. Serological testing is generally used to make a diagnosis of syphilis. If diagnosed early, syphilis can be easily cured, and congenital syphilis can be prevented. In addition, if a patient is diagnosed with syphilis, they should be offered HIV testing, as well as screening for other sexually transmitted diseases. Routine syphilis screening can differ depending on local recommendations, but normally it should be performed on these patient types. In clinical settings, the diagnosis of syphilis may be established by direct or serological methods. Treponemal tests detect IgM and/or IgG antibodies directed against different T. pallidum antigens. A reactive test result indicates a current infection or prior exposure to T. pallidum. These tests are particularly suitable for automated high-throughput screening of asymptomatic populations and blood or plasma donors. Click the blue highlighted text to see the different types of treponemal test. Non-treponemal tests measure levels of IgG and IgM antibodies directed against lipid antigens, principally cardiolipin, released from damaged host cells upon infection. Non-treponemal tests only detect current, active infection. However, these antibodies are not unique to T. pallidum, and a number of clinical conditions may also trigger anti-lipid antibodies. Click the blue highlighted text to see the different types of non-treponemal test. Both treponemal and non-treponemal tests are commonly used in the diagnosis of syphilis. Treponemal tests indicate exposure to the T. pallidum pathogen, and non-treponemal tests help to determine if exposure was past or present. Hover over the treponemal test and non-treponemal test labels for further information. Now that you have learned about the course of syphilis and how it is diagnosed, use that knowledge to determine the stage of syphilis in these 3 patients. The general principle of a diagnostic algorithm for syphilis is based on different combinations of treponemal and non-treponemal tests. There is no overall recommendation on which testing combination should be used for the diagnosis of syphilis, and current testing guidelines vary depending on local recommendations and disease prevalence, as well as laboratory preferences. The 2 most widely used approaches to the serological diagnosis of syphilis are the traditional algorithm and reverse algorithm. A third approach is a variation of the reverse algorithm recommended by the 2014 European Guideline on the Management of Syphilis. Each algorithm is recommended by various bodies around the globe. Click on each algorithm to discover how they differ. The traditional algorithm used for screening and diagnostic purposes begins with a non-treponemal test followed by a treponemal test. It is the least sensitive algorithm across all stages of treponemal infection. Increasingly, laboratories are using automated or semi-automated treponemal antibody tests for screening. Positive samples are then tested with a quantitative non-treponemal test. If the test results disagree, the sample is then tested using a second treponemal test. The variation of the reverse algorithm, recommended by the 2014 European Guideline, begins screening with a treponemal test. When the initial test is reactive, a second different treponemal test is required as a confirmatory test on the first serum. If the second treponemal test is also reactive, a non-treponemal test should follow to assess the disease activity. Roche's solution for syphilis diagnosis includes 2 treponemal tests and 1 non-treponemal test on these analyzers. Click Next for further information on each test. Elexis Syphilis is an electrochemiluminescence immunoassay, ECLIA, which uses a one-step double antigen sandwich (DAGS) principle to detect anti-treponemal IgG and IgM antibodies simultaneously. Treponemal IgG and IgM antibodies are detected with a mixture of biotinylated and ruthenilated recombinant TPN15, TPN17 and TPN47 antigens. Click the buttons to see the steps of the test. Recombinant T pallidum antigens labelled with biotin or ruthenium bind to specific IgM and IgG antibodies from the sample to form a sandwich complex. Streptavidin-coated paramagnetic microparticles are then added, forming a strong bond between the streptavidin on the microparticle and the biotin-labelled antigens. A magnetic force is applied to the measuring cell, anchoring the antibody-antigen complexes. Chemiluminescence is then induced by applying an electric current to the measuring cell, causing the TPA in the solution to interact with the ruthenium, resulting in the production of light measured with a photomultiplier. The signal yield increases with increasing anti-treponemal antibodies in the sample. Sekisui Medi-ACE TPLA2 is an immunoturbidimetric test based on the immunological agglutination test principle using latex as a reaction enhancer. Without this reaction enhancer, low quantities of antitreponemal antibodies in the sample would be difficult to detect. Latex microparticles coated with antigen derived from T. pallidum react to antitreponemal antibodies in the sample to form an agglutinate. This agglutination results in an increase in turbidity which can be measured as absorbance at 700 nanometers. Sekisui Medi-ACE RPR2 is an immunoturbidimetric test based on the immunological agglutination test principle using latex as a reaction enhancer. This provides a clearer output that can be measured through optical measurement rather than just visual observation. Latex particles coated with lipid antigens, cardiolipin and lecithin, react to syphilitic anti-lipid antibodies in the sample to form an agglutinate, which results in an increase in turbidity which can be measured as absorbance at 700 nanometers. Roche is the only company to offer a complete solution with excellent sensitivity at all stages of the infection and excellent overall specificity, even with tests positive for other infectious diseases. Let's see how it can help to address the needs of different potential customers. Drop the target over each of these key opinion leaders, KOL, to learn about their most important unmet needs for syphilis tests. Once drop the target over each of these key opinion leaders, KOL, to learn about their most important unmet needs for syphilis tests. A laboratory is using the reverse algorithm to test a patient sample for suspected syphilis. Roche is the only company who can deliver a complete solution within a single integrated workflow. Using your knowledge, identify in which order they should use each Roche test by dragging and dropping your answer to indicate how the tests should be positioned. When talking to potential customers, you may be faced with their objections, and it is your job to reassure them. Of course, there is no one-solution-fits-all answer when it comes to addressing objections, but here you will encounter an example of how to handle one. Click Next to help the Roche representative handle the objection. In this example, the statements the Roche representative uses to handle the objection have been mixed up. You must order the statements into the recommended sequence. Click the blue text to reveal further information on how to handle the objection at each stage. Congratulations! Now that you've completed this training, please look again at the learning objectives on screen now and consider your level of confidence with each of them. If you feel you need more insight on any of these topics, you can navigate back to the relevant chapters or refer to the PDF for more details. To complete the training, click the End Module button.